Good morning. Good morning. It was a pleasure to see many of you. Some of you we didn't see very last night when we were here for dinner and the welcome reception. I see my youth advisor, Andy, also. It's good to see you in Nairobi. I just want to welcome all of you again to Kenya and to Nairobi and to this lovely place where we're having this big conference of the research conference on population, reproductive health and economic development. I think we really have a team of research papers that will be presented over the next 2 days. And I just want to reflect on a number of things this morning as I was contributing to this conference. The first is if you take a look at the program that is in front of you for the next 2 days, one of the things that may not be very obvious to you is the fact that out of the 18 or 19 papers that you will see outside of the panels and the panel discussions and the welcome addresses and all that, out of that 18 or 19, only one of them is actually from Africa. I was on the panel, the scientific panel for last year's conference, and I do know the hard work panel members go through to select excellent papers that are presented at these conferences. So the fact that this meeting is happening in Africa, and there were the different efforts to reach out to African institutions, researchers, and scholars to actually contribute to this conference, and we end up with one paper, gives you a highlight of the status of research and research undertaking within the African continent. You know, of the billions of dollars invested in research each year, only 0.8% of it are actually invested in Africa. It's not expenditure on research and development. And 50% of that is in South Africa. The other 50% of 0.4% is in the rest of sub-Saharan Africa. I said actually the rest of Africa. So it may not be surprising to many of you when you pick up the papers that are written here and you look them up and you look at the references, even when they are actually completely focused on Africa, that maybe you will see one out of hundreds of references that are actually from an African audience. And yet, it is quite critical that research is so central to development in any country. The ability and capacity of any country to really develop something related and dependent on its ability to generate the type of information that is relevant to its own needs and aspirations and context as well. So, as we are here over the next 2 days, I really want you to reflect on this, because if we're going to change the level of engagement of Africa in research, some of us may have something that we can do. I think for African institutions and organizations, we are coming from a phase where we'll be more of recipients of ideas and makers and models, and we apply them in some sort of collaborative arrangements and relationships. But we increasingly are trying to renegotiate those relationships and engagements, where we actually are partners in defining ideas and priorities and scope of work and all that can be implemented collaboratively with our partners in the North. One of the things that example of this is one of the programs APHRC is so busy with this university in South Africa, the Consortium for Advanced Research Training in Africa, which has brought together African institutions and universities to say, what can we leverage from each other to improve the quality of people that are produced locally through the PhD training. And this is coming out of the understanding that, you know, for many of the people you can look at in Africa today, doing research, you can go back and look at their background. Many of them have gotten some of their graduate training overseas. And yet, for the majority of people who are trained here, their contribution remains quite marginal. And to up that means that we need to create the level of skills and expertise that is required to engage in global knowledge production. Why am I talking about capacity issues where we are in the research conference on population, reproductive health, and economic development? Last night, I did talk about some of the contradictions that is there in Africa. And some of those contradictions actually come out of, the fact that we've not applied our mind to dealing with the real issues that drive development within our context. If you walk out of this beautiful hotel and take a 20-minute walk that direction, I wouldn't go away, that direction, you will be in Kibera. I many of you have heard of Kibera. If I live in Kibera and I walk here, I will walk maybe 15-20 minutes every morning to get here. That's just 15-20 minutes away. That's part of those contradictions we don't have. We bring in ideas and models that have worked in other contexts. And we actually expect them to work in Africa just to understand of some of the contexts and issues that are relevant to us in terms of our engagement. I can give you one example. Some years back, through the research we've done in the slums of Nairobi, highlighting the high levels of maternal mortality in the slums, which was about 760 compared to 440 for Kenya as a whole, led the German government and the Kenyan government to actually pilot a program on output-based approach to reproductive services that will give vouchers to women to go and deliver in maternity centers and hospitals. And you imagine a woman spending about $3, which is more than what they will get in a day, to buy this voucher, and 20% of them will not deliver in a hospital or use that voucher at all. But if you're in labor at 2 o'clock in the morning, even if you can break the security conditions in some of these places, you will not be able to walk the 2 kilometers or 3 kilometers that's required to get to the nearest health facility. So you still end up living at home. Without the same of those things, we initiated a program actually supported by community that looks to see how can you use resources within a particular community to leverage the ability and capacity of women to actually access care where they need it more. Given the absence of public sector and public facilities in slum context and slum environment, can we actually use the private sector and get them up to a point where they can deliver services in line with the guidelines of the Ministry of Health? And if they can work, can we get young people who are passionate about their community and making a change in their community to provide the visit to this woman at 2 o'clock in the morning to get to that health facility? And if everything goes and there is a complication, can we actually get an affordable transport that can get this woman to a nearby health facility? And if we do all these things and do them right, can we reduce maternal mortality in this community from 760 to under 100 in a short period of time? And the point of this is the fact that I think if we care about making a difference in some of the statistics and indicators we see in Africa, I think it then demands that we actually need to engage with institutions and people that are on the ground dealing with these issues at a certain level of engagement that they are not just an advantage of the global knowledge production. I think that's where we are currently, and we want to move forward. We want to move forward with partners that believe in the things that Africa can contribute. I think that we look at those contradictions within Africa. The one way those can change is if we can generate that locally relevant knowledge that can drive policies and programs across the region. We still contribute less than 1% of the global knowledge production, whether you look at patents and scientific publications and things like that. But all that actually takes change. Because of the huge opportunities we have, population growth being a challenge, we see that there can be a resource in some other instances and conditions, if properly managed. The youth has been a challenge, it can be a huge resource if properly invested in and managed. And I've made a point repeatedly that Africa cannot achieve its full development aspirations when we have an army of young people on the streets talking their goods. That is not what is going to help us achieve a level of development and economic growth. But these things come together, and they come together in a very powerful way in Africa that requires us as researchers, as development partners, to really reflect more again on this and the engagement that we have in Africa. I do believe that we will make that transition. Africa is at a point where it can actually leapfrog many decades of underdevelopment through the emerging innovations like in science and technology and ICT and all of that. But with all the other resources that not only the natural resources which many have seen as a cause for Africa, it doesn't have to be. So to us, research is so central. But that research actually needs to be anchored and embedded in these also institutions that are there in these countries and regions that can then engage with the government in a very strong partnership that can drive policy shift and policy change. Just last December, we presented the results we did in Kenya here, looking at graciously funded by the UN Foundation on primary school access in urban centers across Kenya. We covered 6 urban cities in Kenya, and looking at the poor and how they access or benefit from the free primary education policy and the level of support they get and competencies of teachers in instructing them. And one of the things that we came out of that particular study was the fact that the policy currently in Kenya is that if you are teaching primary school students, you teach everything. So even if you got an A in mathematics in your tertiary program, you still teach them mathematics. And we have teachers teaching mathematics who, if you give them tests based on the courses they are teaching, they get only 8%. And I don't know how many of us would like our children to be taught mathematics by a teacher who gets 8% in the content area of teaching. Through that, both the Kenya National Union of Teachers, the Ministry of Education, and all that are actually revisiting their policy around what teachers should teach. The teachers the fact that you got 10% in mathematics doesn't mean you're a bad teacher. It means that you never be a good teacher of mathematics. But you might be an excellent teacher of Swahili or English or some of social studies. And if you can get that level of engagement, you can actually improve student performance. And that is so central to the human capital that we need to develop to drive Africa's development going forward. So I think these things together will really encourage us as we reflect over the next 2 days and look at this meeting taking place in Nairobi, and with very little engagement of principally in the region. Some of the challenges we face currently in the region, the job is not done. The effort to really show the support and strengthen capacity development within the African continent is still one that we need to continue to engage in. We have a number of very bright young people. If you come out to the first class today, in any subject in a university here, the first place you're going to be looking to work for is the bank or the telecommunication industry. It's not a research organization. We need to change that. These are the bright lines that can continue to lead Africa forward. And we need to find creative ways to really engage in supporting this level of research development in Africa. I think it's so central and it's so important that it becomes part of the discourse that we have as we continue in this process. So again, I don't want to cancel the schedule of this meeting. I think it's an excellent meeting and I'm looking forward to the next 2 days. I just want to highlight the passions and challenges we face within the region. So as you spend the 2 days here, think about it. What can you do in terms of your partnership and engagement with different African institutions that ensure by the time you are not in the state, you actually have left behind a number of people who are able to speak effectively for the issues that Africa currently faces. I think that's what we need to do. And I look forward to continuing discussions with all of us. Thank you and welcome to Kenya.